Hello, I'm Dr. Calin Tataru from Romania. And first of all, I want to thank you very much to all the leaders of MIOM conference, and especially to Professor Asha Parmia, who invited me at this amazing conference. Thank you again. I try to be a little short. Okay. I will present some cases. The first case, it's a case we underwent intracapsular extraction 30 years ago with a good vision with correction, as you can see. And I will present the case. Sorry. This is a photo, the left eye and the right eye. This is the image of anterior OCT, and this is a film. This video marks some question. I make some vitrectomy from the anterior vitrectomy. I try to put out the iris from the old suture of the wound, and I try in a Canabrava manner to center the pupil using this endodiathermy probe, who works very, very well. This is my way to attach the lens to the sclera. I make two grooves, as you can see. The first loop, it's easy out through a needle that direct the loop, and the second with a 25 forceps, it's also out of the eyes. With a thread of Prolen 10 wall, I make a Sipser knot, passing through the loop 4 or 5 times the thread, and this is the Sipser maneuver. And at the end, I introduce the end of the loops of the implant in the bag. This is the final aspect, and this is the final, let's see, visual acuity. As you can see, with a small cylinder, it's a very, very good result. The second case, it's also a trauma with uncorrected vision 0.2, not correction with 0.10 opaque, because it was a cataract, important cataract, and I decide to implant 20 diopters of monofocal lens. This is a surgery. Usually I make the rhexis under water with a needle, as shown. It was, let's say, normal surgery with a not very hard nucleus. In Romania, also like here, we find very, very hard nucleus. And after the implantation of the lens, I make the same maneuver with a Sipser knot to attach the margin of the iris and to center the pupil. I make only one knot at the border of the pupil because I want to have a centered pupil. This is the final aspect, but unfortunately, the second day the pupil wasn't centered, not at all. And after weeks, I decide to make a reintervention. Of course, my team dilated the pupil, but it's not a problem. I don't use adrenaline in the maintainer, in the anterior chamber maintainer. And in the same manner, you will see with a diathermy probe for retina, I try to center in Canabrava manner this pupil. And this is the final aspect with a good result also. And the third case is a congenital cataract, as you can see, with a big anisometropia between the left and right eye, and I decide to implant a monofocal toric IOL. And this is the surgery. Now the pupil is dilated. We dilated because after in a normal way we can see the pupil, and I mark the horizontal axis for implantation. With this vitro probe, I try to make around the pupil and to get out the membrane, the pupillary membrane. And in the same manner, I try to center this pupil. Of course, after this maneuver, the rexis under the pupil to be a little large, around 5 millimeters in diameter, and relatively soft cataract with a normal implantation of a toric lens that I with axis of 0-180. The final adjustment of the pupil, and this is the final aspect with the improved visual acuity, and of course with this nice aspect at the end. And because I have more 3 minutes, this is a trauma, an important trauma, as you can see, with a very low visual acuity, and only for the idea to reattach this iris who is very bad, in a bad condition. I pass from the sclera to the iris 3 loops of 10-Hall Prolen, as you can see. I don't detach the conjunctiva, and using also Canabrava method, I try to recenter the iris and to recenter the pupil. And at the end, with of course, with this probe, with this cutter, incandescent cutter, I make some flanges at the end of the fret. This is the aspect after the surgery, and 1 month after that, I suture a toric lens with very, very good results. Thank you very much for your attention.
Thank you so much. I think any comments from Ashraf?
Thank you, Dr. Tataru. I want to remember that Dr. Tataru is Professor Tataru is the president of Romanian Cataract Surgery, Refractive and Surgery. Welcome to Mayam, Professor.
Thank you very much.
I think request all the delegates to wait for the keynote lecture award.